Thank you, Madam Chair. So good evening, everyone. So my report was in the package. I'm going to hit the highlights of that. So under our strategic direction of strengthening the processes that drive a culture of patient safety and quality care, our surgical safari tours resumed this month. So this is a fun, interactive preoperative tour for children that are ages 3 to 12 having surgery at Windsor Regional Hospital. And these are led by our child life specialists. So they provide age-appropriate explanations of what the child will see and do on the day of surgery. And children really benefit from this information and how it's presented. I apologize for my dog in the background here. We also are proceeding with the installation of our LINAC bunker. So that started the last week of October, and the machine itself is targeted to be up and running on December 9th. And then we'll continue on with our plans to replace our existing LINACs. Our new MRI is also up and running at the OLET campus, and we're in the planning phases to upgrade the other MRI at the OLET site. And our cath lab expansion project is well underway, and we're looking forward to having 2 cath lab tables available to serve our community and catchment area. We are entering our respiratory virus season, and from a provincial lens, we're seeing a percent positivity of COVID of about 11.4%, which is actually lower than the previous week. And our other virus positivity indicators are influenza 0.8%, RSV at 4.1%, enterorhinovirus at 10%. And so our current trends are running lower than last week for COVID and influenza, and RSV is slightly higher than last week. And so the trend compared to last year at this time is lower than this time last year. At Windsor Regional, over the last 2 months, we've been averaging about 10 to 18 cases of hospitalized COVID cases, which is lower than this time last year. 20 to 35 cases of other acute respiratory viruses, and the numbers of influenza and RSV remain low in the hospital. We had 1 of each case hospitalized in the past week, and a slight bump up with RSV this week to about 3 cases. So just to promote prevention for respiratory virus transmission, if you've not yet received your vaccinations for COVID, influenza, or RSV, we've got the link in the package, but you can go to ontario.ca. And they have a link there that you can click on to find out where you can get your COVID-19 vaccines or your influenza vaccines. And of course, always like to promote hand washing, staying at home if you have symptoms, coughing and sneezing into a tissue or your elbow if a tissue is not available, keeping your distance from people that are sick, keeping surfaces clean if someone is sick in your home, and wearing a mask if you're at increased risk from infection to protect yourself, or if you have to go out and you're sick to protect others. So we did update our masking requirements at Windsor Regional back in October to help prevent spread of respiratory illness to our patients, staff, and visitors. So we just ask that people check the signage in the clinical areas that they're visiting for any masking requirements. So those are the highlights from my report. I'm happy to take any questions.